I want to point out to the Honourable Finance Minister, in her absence, of course, that 1/3 of our population lives under 100 rupees a day. And if we are to have a budget that addresses their needs, we must pay attention to those crucial sectors of our economy that are conspicuous in their absence from this budget. My colleague Kumari Shelja has already addressed the emissions and agriculture, so in the interest of time, I won't touch that and farmers' welfare. But consider, for instance, that the word health is mentioned only 4 times in the speech. Indeed, Madam Minister did not even discuss healthcare at length. At a time in India when 55 million of our most vulnerable citizens are annually cast below the poverty line because of having to spend on healthcare, this budget offers nothing tangible for this vital sector. Was it really so long ago, Mr. Chairman, that COVID-19 rampaged through across the world, wreaking havoc and exposing our massively inadequate and ineffective healthcare sector? Yet, if one were to look at the budget, it would seem that the pandemic has been forgotten, for allocations to the Ministry of Health and Family Welfare have decreased as a share of the overall expenditure from 2.16% in 2019 to 1.9% in the budget. At the same time, the Ministry of Ayush has had an allocation nearly doubling. The fact is that India is just not spending enough on health. Brazil, Russia, China, South Africa, the other BRICS countries spend roughly 14 to 15 times more than us. Until recently, even Bhutan, Nepal, Maldives were outspending us. This year, the budget outlay for health has seen a minuscule rise, yet far from the aspiration of 5% of the GDP, the Modi government's health expenditure as a proportion of GDP remains stagnant, and we are even distant from spending the minimum 2.5% that was outlined by their government in the National Health Policy.